I think that admitting that you want some support or wanting to chat to someone about how things are going in your life, um, that there's a fear that that might be looked upon as a weakness, and that you can't get over it yourself and can't just deal with it by yourself. Especially in Australia, when we have a lot of a lot of attitudes like, get over it, toughen up, and be a man, and that sort of thing. I don't think those words are very helpful.
More than 1 in 5 young Australian males will experience mental ill health, but only a small proportion of those will access services. We know that young males comprise only a third of the mental health care plans provided by GPs. Worryingly though, young males are almost 3 times as likely to lose their life to suicide relative to young females. These are very concerning statistics and paint a worrying picture about the mental health of young Australian males. There are a number of significant barriers when it comes to young men engaging with mental health services. One of the most significant barriers relates to stigma. We put a lot of pressure on young Australian males when it comes to ideas like masculinity, and that taps into notions of strength and stoicism and invulnerability, and young men often find it difficult thinking about disclosing difficult, hard to talk about emotions. We also need to think carefully about specific groups of young males, so young males from culturally diverse backgrounds and young males from sexuality diverse backgrounds. We must get better at engaging these populations as well.
Traditional social norms of like what men are supposed to look like, what men are supposed to act like, they're everywhere. They're like I can't even drive to work without seeing a billboard of someone advertising cologne or Bonds underwear that looks like like the perfect figure of like just like you stepped out of ancient Greece or something. It's easy when you see pictures like that all the time to make a connection and think, am I supposed to look like that? Or is that supposed to be me? Or and then all that does is creates a disconnect. All it does is makes people feel like that's not me, and I don't connect with that. And if that's what a man's supposed to look like, that looks like the sort of man who wouldn't access mental health services. It looks like he's got everything going on for him. It looks like he wouldn't have trouble trying to find a girlfriend. He wouldn't have trouble fitting in at work. He looks like everything that a man's supposed to be. It looks like life would come easy to him, which is not true.
A young man may see a GP or present to a mental health service with a different range of symptoms, and these may include anger, risk-taking, or problematic patterns of substance use. We need to get better at recognising that these symptoms could reflect distress or an underlying mental health issue. We also need our assessments to be better at detecting the different ways in which young men may present.
I think young men need to be involved in their recovery as much as a psychologist is, or as much as a psychiatrist is, or whoever it is that a young man is going to see, because we need to feel like we have ownership of the direction that our lives are taking. I think peer workers in this field are paramount, and are going to do a lot of amazing work to help young people coming into a mental health service feel like they have someone to relate to, and they're not just reading something abstract on like in a book or on TV. It's someone real that they can talk to who's maybe gone through something similar.
The window to engaging young men in mental health services can be pretty narrow, but there are a few things we can do to nudge it open a bit more. We need to make sure that we're developing and testing new models of peer support, and that we're leveraging the next generation of digital technologies in that work. Most importantly, we need to make sure that we're engaging young men as partners in the co-design of the next generation of mental health services and mental health interventions, and that we do that with young men in mind.